My leg's still quite painful and swollen. Is there anything else I can do to help with my recovery?
Yes, there are a few things you can do yourself, in addition to the medical treatment you should keep following. I'll explain them to you now.
That would be great, thanks.
It's a good idea to put an ice pack on your leg for 15 to 20 minutes, every 2 to 3 hours during the first 48 hours after your injury. The ice pack helps to constrict the blood vessels and reduces blood flow to the injury. That will help bring down swelling in the area. The cold temperature of the ice pack also numbs the area, which reduces pain signals traveling to the brain. After 48 hours, just use the ice pack every 4 to 6 hours to manage the pain or swelling in your leg.
Okay. I can do that.
Just remember to wrap the ice pack in a thin cloth to avoid direct contact with your skin. Putting an ice pack directly onto the skin can lead to frostbite or skin damage. And, you should always remove the ice pack straight away if you experience tingling or excessive cold sensations.
Right. I'll be careful about that. What else can I do?
Another thing that helps bring down swelling is to put your leg up on a pillow or cushion for about 15 minutes. Keep it elevated above the level of your heart to encourage excess fluid to drain away from the swollen area. Try to do this 3 or 4 times a day.
Okay, I can manage that. Is there anything else?
The last recommendation is to wear a protective boot whenever you're walking about. Make sure the boot fits well and the straps are tight enough to support your leg. If your leg becomes numb or you feel any tingling, the boot is too tight and you need to loosen it immediately.
How do I walk with the boot?
When you walk with the protective boot, make sure you use crutches to reduce the amount of weight you put on your injured leg. Keep your body upright and use your arms to support your weight. If you can, try not to lean heavily to one side.
Okay, I understand. How long should I wear the boot each day?
Wear the boot whenever you're on your feet, and remove it when you're resting or sleeping. You should also take the boot off when you're doing your exercises.
Okay.
Finally, keep the boot clean and dry to avoid fungal infections.
Okay. I'll follow all your advice and hope my leg feels better soon.